What will happen if my dog's meniscus is healthy, but then when they're recovering, it begins to click? Now this is important because some doctors will just say, let's wait and see how they do, and if that click resolves, because sometimes it does. So make sure you ask, this is actually a two-part, so go ahead and ask, what will they do, if anything, for a meniscus that was healthy that then maybe tears after surgery? And then what is the clicking sound that some people hear after their dog has surgery? Sometimes it resolves, so I'd like you to, and that means goes away. It goes away on its own. This happened with my dog, so make sure you talk to the doctor about that. Will my dog need strict crate rest, or can I use a small recovery area? Now this one is important. A lot of doctors, especially the lateral suture ones, will want your dog to be a little bit more confined because post-op, they're a little bit more fragile, let's say, than a dog that had a bone cutting procedure. Because when we think about the procedure itself, we're talking about a little synthetic cord that's kind of threaded through bones versus plates, metal plates, or a metal wedge that is reinforced with pins and screws, right? So one is stable and one is less stable. The less stable repair dogs do better with a little less movement. All it takes is a little bit of a pull on the leash, a little run, a little jump, and then they can break that suture material. Do know what your doctor expects as far as confinement post-op. One thing I want you to ask, if your doctor says, I prefer a crate, if you are really diligent, and I mean like really diligent, because you need to watch like a hawk, you can have a recovery area that is just a little small space, and you can use an exercise pen to kind of wall it off. You put their bed in there. If you have tile or wood floors, you would want to cover that up with throw rugs or unrolled yoga mats, anything so that your dog won't slip on the floor. A little movement is actually healthy and good, and a lot of surgeons, fortunately my dog surgeon recommended a little bit of movement post-op, because it's the movement that keeps the muscles, it's not keeps the muscles strong, it actually helps them to strengthen post-op. It is the movement that helps reduce the inflammation along with the medication. A little bit of movement can be a beneficial thing for healing. Will my dog's incision be stapled, sutured, or glued closed? And then in the case of staples or sutures, when will they be removed? With meds that need to be given on a full stomach or with a meal, what do I do if my dog has refused to eat? There are ways to help your dog take the medication, and sometimes it is helpful to know what foods you can stick a pill in. I have podcasts about this, and I have blog posts about this, and if you are in my Facebook group, we have talked about this in Facebook. There are about, I think, 17 or 18 foods that you can hide pills in to help them go down a little easier if your dog is not okay with you pilling them in the traditional way. What should I do if my dog throws up from the pain medication or the antibiotic? Can I give Prilosec or Prevacid, and if so, what dosage and which one of the medications? And I say this because I think it's called Prilosec AC. There's one Prilosec that has other stuff in it besides the omeprazole, so you should ask because your dog's weight will be dependent on what dosage they get, and also ask about the frequency. So with omeprazole, how much do I give and how often do I give it? Can you tell me about your complication rates and things like implant failure, implant rejection, infection, things like that? Now you want to know these things not because you're questioning the doctor's ability. Sometimes you can have the very best surgeon and infections happen, or the implant is not tolerated by the dog, or things can go wrong with the implant. So know this ahead of time. You want to know if the surgical technique itself is stable and sound. There is one technique that is coming to mind that is just not perfect yet. And I can't say that really anyone is perfect. Every surgical procedure has its pros and cons. But the one with the most post-op issues and surgical challenges is CBLO. And I don't say that because dogs who have CBLO do terribly afterward. It's one where they're still doing surgical augmentations. They're trying to perfect that technique still. If your dog is going to get CBLO, I'm kind of spinning off here, make sure that the doctor is doing the latest augmentation with the tension band and the pin, and not the old school way of doing it. We can't even say old school CBLO because it's a relatively new technique. My dog is already taking pain medication, but their surgery is scheduled soon, maybe in a week or whenever. How soon before surgery should I stop giving all medications? It isn't just medications that can thin the blood and then promote excessive bleeding during a procedure. It's also certain supplements, things with vitamin A, omega-3 fatty acids. Things like this can thin the blood, and so when the doctor then makes their cuts, the dog can excessively bleed. So I was instructed 1 week before to stop the pain medication. You want to know that before your dog has surgery. Can I use an ice pack or a heating pad after surgery? Now, some doctors like right after surgery to use ice. Make sure you understand how to safely apply ice to your dog's leg. It doesn't mean you're going to use that big heavy ice pack like you might use on yourself. You want to get some small ones. Your doctor is going to talk to you about the importance of using a little thin towel, like a tea towel or a dish towel, between the ice pack and your dog's leg. This is to prevent basically frostbite. You don't want that area to get too cold for too long. And then if you're using heat, you still want to use a towel, even if the heating pad has a little cover to it. You still need to use a towel to protect the skin from not getting too hot. You want to ask about how long you should leave the heating pad or ice pack in place, and then how many times a day you should be doing it. And also when to switch from ice to heat. Some doctors like heat right from the start. Will my dog need physical therapy? Some doctors have a physical therapy facility right within the animal hospital, and that's really nice because they have usually the latest tech, like cold laser or a hydrotherapy tank. They have certified canine physiotherapists, which is so good. So some places have PT already established and in place, and the doctors know, like, and trust their PT people and might recommend them. But if you're going to do PT at home, you want to know when you should start, and if your doctor has any suggested physical therapy exercises written down for you. Do you recommend hydrotherapy or water tank therapy? And if so, is there anyone that you recommend? Now, with hydrotherapy, if the dog's sutures are still in place, they cannot go into the hydro tank because there can be bacteria that can then get into the incision and cause an infection. So the next question is, after stitches are removed or staples are removed, how soon can my dog go into the hydrotherapy tank? When can I expect my dog to poop after surgery? This might take longer than you think because the dog is on strong pain medications, and what do? They constipate. This happens with people too. So you want to know how many days should go by before you start getting nervous. And if your dog doesn't poop, you need to know what to do. Is there something that the doctor wants you to feed them? Should you be given a laxative? Will the dog be given an enema? What happens in this case? How will I know if my dog is in pain? There are lots of signs that your dog will give to you to show you they're in pain. You want to go over these with the doctor so that you know what to do. And then if the pain is excessive and it seems like the pain medication isn't controlling the symptom, then will the doctor prescribe a different pain medication? The doctor might also say we can up the dosage of the current pain med, or we can give it a little bit more frequently. I bet you thought I would never stop. And it felt like it took a long time to go through those. But you see, when you have a surgical consult, you want to make the most of that time because that's when you've got the doctor's attention. You want to get the information ahead of time so that you're not one of the people who is post-op wondering, oh my gosh, I should have asked this. Oh my, why didn't I ask that? Ask now. It's okay, it's going to take some time. Use the time wisely. And you know what? All these things that I just read off, here are all my questions. You don't have to even take notes. You can get these yourself on my website at runagainrover.com. Go to the Learn More About CCL Injury tab, and you will see questions to ask the surgeon. You can print them out, stick them in a Word doc if you want, or you can go to my Facebook group if you're part of my CCL Surgery and Recovery private Facebook group. Go to the Files section there, and you can print them off right from Facebook. Now there's lots more to learn. Don't leave just yet. Come with me to the next video. I'll see you there. If you like what you're watching, give me a thumbs up by clicking that little like button, and then also subscribe.